Well, welcome everyone. Thank you for joining us today. We're talking about the value of behavioral health screening in the workplace. Really appreciate you taking the time to join us for this conversation. I'm Lisa Desai, a psychologist with MindWise Innovations.
And I'm Maggie Mortelli. I'm a Senior Program Director for the American Foundation for Suicide Prevention.
So at the outset, I want to remind everyone that this is a collaboration between the AAS, AFSP, and United Suicide Survivors International. So very grateful for those partnerships. And the goals for today are to take a look at universal screening, selective screening, and then using case studies and best practices to get a sense of the utility and how that can be implemented across the workplace. So in thinking about the guiding principles for workplace suicide prevention, Maggie and I were thinking about how so much of what we are going to talk about really touches upon all of the 8 guiding principles, certainly the comprehensive kind of systemic way in which screening can be used. And when we look even more detailed in terms of what are the 9 practices to implement the guidelines, we look at leadership, communication, so much around screening and how it's used can really enhance communication around mental health. Certainly a self-care orientation, very much about checking with oneself and loved ones around their mental health. And to especially with Maggie's program, the crisis response and the way that an individual can connect directly with a provider. So what I'll be talking about is the way that we use the screening program in terms of a universal approach. And so a universal approach is really a population-based approach to increase mental health awareness and education across a community, whether it's a city, a state, the workplace, or colleges, universities. The hope is to increase early identification so that people can begin to use strategies to help themselves, to talk with one another, and to reach out for help. The goals are, again, to give a population the information in the same way that we think about physical health and physical screening and the signs to look for. It's very much on par with that. I think a really great thing about population-based information dissemination is it overrides that assumption that we can only target certain groups, which is absolutely important. But sometimes there's certainly, as we all know, people suffering in our communities in the workplace that may be missed if they're not part of that targeted group. Ideally, the hope is to build resilience as people learn more about mental health issues and how to reach out for help. Looking at what is the value of screening in general, whether it's selective, whether it's universal, and the early identification is key. You can see in this chart, it's not a surprise that it's about 3 to 4 year difference between when a symptom may appear and when that group or that individual may reach out for treatment. Some studies have shown there's even up to a 10-year wait. Sometimes that is due to lack of resources that are accessible to individuals. We know in the workplace, like anywhere, but particularly the workplace, I think we all agree it's a human imperative to do the right thing and to address these issues for your employees. We also know that the bottom line makes a difference in people reaching out, employers in leadership reaching out, because it does in fact impact presenteeism and absenteeism and related productivity factors. So our screening program is completely anonymous. I noticed it's not listed here. It is anonymous. There's no identifying information that's asked for or stored. There are 13 brief validated screens. And the customization for our organizations, for instance, is so that they can decide what demographic questions they want to ask. And in one of the case studies, I'll touch upon how that can be used and what the resources are that they want to utilize to kind of drive their employees to maximize what is already being provided by the organization and also to provide a lot of education. And then the second case study is a more simplistic approach with Chevron, who we worked with for many years. And they were about 5 years ago, really started incorporating mental health awareness into their employee wellness. So what they do is include reward points, if you will, for individuals seeking out various behavioral health resources they make available, including the screening program and our educational materials. And what I really like about that is it again reinforces the idea that if we think about mental health in terms of our behavioral health, we're thinking about it in a continuum. We're decreasing the stigma around it, increasing conversations, and hopefully increasing help seeking.
This next section is going to talk a little bit about our interactive screening program, which is really a selective approach to screening, whereby we are targeting more specific populations of individuals. It's not a population-based screening like universal screening is, and a focus is really to look at high-risk groups, specifically for selective screening, but also I think our approach has broadened that a little bit to really kind of target groups identified by the organizations or workplaces, and really looking at embedding this program within their EAP and looking at really their sort of service engagement, overall service engagement of the EAP, identifying which groups of folks are reaching out to EAP and utilizing the service, and then using this program to target specifically the groups that are not. And so it will often focus on very kind of low service utilizers or folks with lower service utilization, and that combined with groups where they've identified maybe some higher barriers to help seeking. So similarly, using an online platform, and that does allow for anonymity, we link out customized support services and crisis resources. The program itself is typically embedded within an EAP, or in some cases a peer support program that's provided by the workplace. And so it will really be reflective of the resources and services that are available to the participants themselves and those in that target group. We have a messaging feature as part of the program, because again, our goal in this selective approach is really to use screening as a form of treatment engagement. And so this sort of direct connection that's provided on the online platform is really meant to connect those screened with the EAP counselors or EAP services. And so there is a kind of messaging feature to facilitate that connection. In September of 2015, we were approached by an EAP that was serving a large government agency with a very dispersed workforce. And the groups that they had kind of identified in terms of their low service utilization groups and those with high barriers to help seeking were employees that were in transition and relocation. So they identified that in any given year, there were about 3,200 employees that were being relocated to different geographic areas across the country, across the United States, and some into Canada. And so they really wanted to target that population in different groups throughout the year by implementing ISP as a way to serve as a method of engagement into EAP services. So this is data looking at from program launch in October of 2016 through October 2019. So again, it's a more selective approach, so it's going to be smaller numbers of those screened. And when we look at engagement, we're looking not just at the number of individuals that submitted the questionnaire, but then sort of their engagement on the platform and then into EAP services. And so this is sort of this pathway that's outlined here. I would say just most notably that 80% after taking the screening returned to the website to engage with the counselor, whether it was reading their response to their questionnaire, and then from there, 50% engaging in messages. These messages are typically about, what is EAP? Is it really confidential? How much does it cost? What services are available? Again, some of that information that is available, but for folks who are not necessarily ready to engage in services may need some more time and information. So just, I think to really highlight the value of both universal and selective screening programs, certainly the combination too. I think there's so much value in being able to screen everyone and offer that as a method of self-screen and engagement through screening promotion, getting involved with national screening days and other ways to get folks involved in screening for themselves, for their family members, and those really covered by the service. And certainly as a method of connection to support services, whether it's through service promotion, like a universal screening program, or into services like the more selective screening approaches. And really the overall goal here is to really raise that behavioral health awareness across populations. So just a few resources. The workplacesuicideprevention.com website, the section under resources, there's a variety of programs outlined there, including our 2 screening programs, and then direct links to our websites to learn more.